Hi, my name is Dr. Arthur Salvador. I'm specializing in emergency medicine and also subspecializing in hyperbaric medicine. The patient is basically my father-in-law. Sa medical textbooks kasi, it's always stated there that pancreatic cancer is an aggressive cancer. And you have the tumor markers to prove that. So even if nakakimo ka na, hindi ganun ka-rapid yung decrease eh. And eto pa talaga kasi pancreatic cancer eh. It has something to do of course with digestion, the food that you intake ang nagpo-produce ng enzymes so that we can utilize the nutrients in that food. Pancreas, yun ang nadali. From a clinical perspective, when we're talking of cancer, di kasi pwedeng i-take away natin ang nutrition. A lot of cancer patients really succumb to mortality because of malnutrition. So initially, when we started the Baron, nakita kasi namin yung effect eh. Especially after a week, makita mo sa kanya mas lively siya and he doesn't even realize that. Pero kami, makita namin sa kanya na he's getting livelier. Andun na siya sa backyard, nag-trim ng kanyang mga favorite plants. Sabi namin, parang hindi naman na-mention sa medical textbooks na ganito dapat ang progress. But it's happening to him. And I know of cancer patients also, I don't see that kind of pattern among these patients dun sa clerkship namin, sa residency. Even sa mga patients na pumupunta sa emergency department, you see them deteriorating weekly, monthly, no, if not daily, for this kind of cancer. Pero ang papareho kasi, progressively improving day by day. I'm not over-exaggerating, but it's really day by day. So each day, you can see the difference because you can see that his sleep is getting better. He doesn't have much discomfort, no, as the day go by. Among all his patients, si Papa Rio lang ang as if walang sakit, walang side effects talaga. Maybe a bit nauseated, pero it would only last for a day or two. After that, back to his routine daily activities sa bahay, no. And even nung pumupunta siya sa hospital for the chemo, yung mga classmates niya dun would always wonder, how come this guy's just walking like a normal person is as if he doesn't have the disease? In one word, remarkable. For a patient having an aggressive type of cancer, it's a remarkable thing. First of all, kasi for this particular condition, cancer, kahit sinong oncologist siguro tatanungin mo, would agree na it's brought about by chronic inflammation, whether it's subclinical or clinical. All the unhealthy foods that you've taken, even since bata ka pa hanggang sa naging adult ka na, cumulative kasi yan siya na result, no? When the disease is already there and you undergo the treatment, all the more that yung katawan mo is experiencing all the side effects. So, vicious cycle na siya. Ang ginawa kasi ng Baron method from our perspective is that na-facilitate ni Baron yung recovery by mitigating the side effects of chemo, by empowering the patient's physiology, and of course, yung healing process, no? Because the body needs substrates, nutrients, the right mindset, the confidence for it to realize healing. If makulangan dun sa isa, you're compromising the healing process. So si Baron, dun siya nagkamin eh. Actually, kapag nagkakanda kami ng monthly conferences, if not weekly yun sa first eh, you can really see that even si Papa Rio, nagigain siya ng confidence that he's gonna get better. And that's very important, no? You have to have yung partners mo dito, yung oncologist mo, kailangan confident ka din. No? So the trust should be there. For my fellow specialists naman, I'm just very thankful na we partnered with an oncologist who supports what we think is best for our patient. No? Hindi niya kami pinagbawalan for this therapy. Sabi pa nga niya, whatever it is that you're doing, just keep it up because it's doing great. After all, kami mga doctors, mga clinical specialists, what we want for our patients is to get better. That's it. In whatever way na they get better, we have to apply that. As long as it doesn't harm the patient, no? Nakita naman namin eh, kasi every month we see improvement, no? Wala namang effect sa kidneys nor sa liver. So, ako, sa medicine kasi, first, do no harm. Yun talaga ang isa sa mga red flag signs ko eh. If it's doing something harmful and makita ko yan sa diagnostics, we have to stop that. Pero we didn't see that, no? Wala kaming nakitang impact sa kidney or liver niya. Yung liver enzymes, baba, no? Yung CA19-9, exponentially, bumababa. Yung tumor itself, it shrunk to 6 cms, more than half. And then, ngayon, it's just 1 cm, 1 centimeter na size. We have to go back to the basics. Nutrition, no? And Baron really is empowering the patient to get good nutrition and lifestyle. Kaya nga pabata yung cancer ngayon eh. Kasi ang lifestyle ngayon is really different from the lifestyle of the baby boomer batch. No? And I think you'll see a lot of videos on that sa YouTube or even sa ChatGPT. You can even find that. No? So all these things, nutrition, lifestyle, we have to be very keen about it. Kita nyo naman yung cancer patient na sinabihan pa ng isang physician na you wouldn't last 3 months. Now he's walking 15,000 steps. So that was really, eye-opener sa amin that it's possible.